Today I will be talking about therapeutic cupping. You might think back to the 2016 Rio Olympics with Michael Phelps in those bruised, perfectly circular, perfect dots polka dotted all down his back and shoulders. It is a very common treatment nowadays, used by trainers and physical therapists. I feel qualified to speak about this because I have spoken with many trainers, read articles, and have personally had cupping done on my back and shoulders. Today I will be talking about cupping and the history of it, the benefits it has for athletes and their recovery. Lastly, the ailments outside of sports that it can help with as well. For those of you that do not know, we will begin with discussing what is cupping. Cupping, according to the Journal of Functional Morphology and Kinesiology published in 2012, Giuseppe Musecki defines cupping as a technique using suction cups, which creates negative pressures, and I quote, to release soft tissue, drain excess fluid and toxins, loosen adhesion, lift connective tissue, and bring flow to stagnant skin. That, in theory, is what causes the bruises by releasing the old, dried up blood and by releasing excess fluid as well from those muscles. In an article titled Clinical Research Evidence of Cupping Therapy in China, Systematic Literature Review, Huang Xiao and his other authors published in 2010 that the history of cupping does not have a definitive origin, but it has a deep history going back to 3,000 years of Chinese culture, where the Chinese claims it helps with cough, asthma, acne, and hepatitis, just to name a few. But it is also used in many other places in the world before this. As you can see, there are many claims and to the benefit of cupping, not all research, but has one that has been researched is the athletic benefits it may provide. De Li Sun and his researchers published in the Journal of Acupuncture and Tuina Science in 2012 that it was found to relieve muscle pain and tightness by increasing blood flow and releasing the lactic acid out of the muscles. This, in theory, would loosen and restore your muscles, leaving them to feel looser and tighter. By bringing that blood out, it allows for the muscles to recover quicker. Bridget Rihanna and her co-authors published in an article titled Effects of Cupping Therapy in Amateur and Professional Athletes, Systematic Review of Randomized Controlled Trials in 2012, that athletes, if they were cupped before training, the athlete's perception was reported as significantly lower as their exertion of energy, meaning that if they were cupped prior, the athletes felt better during training, feeling that it was an easier session than were in the previous times. With the same session, they reported it as being more strenuous on their bodies. This shows that your legs might not be recovered, but it's perceived by the players that their legs felt lighter and looser, and it was a less strenuous activity for them. As you can see, there are many benefits cupping can provide for athletes, but it can also help with non-athletic ailments. It can help with your everyday aches and pains. And in a 2016 article, Li Mingqi and his co-authors published in an article titled The Effective of Cupping Therapy on Relieving Chronic Neck and Shoulder Pain, a randomized controlled trial, that it helped with low back pain, shoulder pain, tension headaches, and arthritis. Mostly musculoskeletal muscles in your upper and lower back and shoulders. And those who receive this treatment of cupping, after cupping, perceived 20% lower report of pain, meaning that on a scale of 1 to 10, they were 2 points lower after cupping that they reported. Non-muscular problems too can be solved by cupping. Blood pressure increases. It was found that it would decrease blood pressure. When it was cupped, the blood would rise to the surface, opening up blood and bringing it back, and it also opened up the arteries, allowing more flow of blood and less pressure on the artery wall, causing your blood pressure to lower. In conclusion, it may leave you bruised in pain, bruised and polka dotted, but feeling better. Worldwide, many countries with their claims and benefits claiming that it helps with this and that, but there has not been enough research to prove that. But with the research that has been done, it has proven that it helps aid rehab and recovery for athletes, as well as for anyone suffering from various issues that has research to support it. In the 2010 film Karate Kid, Mr. Han, or played by Jackie Chan, used cupping on Jaden Smith, and it was demonstrated perfectly. It might not have had the most realistic effect of what it would have done, but it was realistically portrayed, and he ended up going on and winning the gold for the USA in that tournament. But it's also very similar to Michael Phelps, going back to him with the shoulder tightness and soreness, and he gets cupped and goes on to win multiple gold medals in the Rio Olympics. Thank you.